This is Chris Barnhart from Healthcare Sales 101, and today we're going to talk about a really interesting Paladin install that was done at St. Luke's in Duluth, Minnesota. And we are lucky enough to have with us Tara Hawkins, who is the manager of the surgery and procedural care. And they just finished the expansion on their surgical facility. So Tara, we're glad to have you here with us.
Well, thanks for inviting me, Chris.
We know that they installed the Paladin equipment management rail at your facility. I want to back up even farther than that, and can we talk a little bit about the process at the front end of it? Was this the first time you had used the Paladin product?
Yeah, this is the first time I personally have worked with the Paladin rail system. We thought it would be a good idea to incorporate that into our op and post-op care areas to have everything right there at the bedside for our patients. I think one of the most important things that Paladin has brought to each room is the ability to standardize each room and design it with the ability to have everything off the floor for easy cleaning. We can neatly have all the necessary equipment and supplies in each room to pre- and post-op our patients. So that's been one of the really nice features of this system in each of those rooms.
Now, when they introduced it to you as a possible product, was there a deciding factor that when they were talking to you, you said, "Wow, that is great. That's what we need"?
Well, I think the adjustability factor of the rail system
Okay.
is great. You can put anything on the rail system you need, whether it be the garbage can, the sharps container, the soap dispenser, the paper towel holder. Just about anything can be put on the system. And the adjustability factor of it is great because you can get in there and you can work with it. And if you don't like where something's located, you can easily move it without dealing with patching up walls and nail holes and that kind of thing. The other feature that was appealing to us was the ability to have everything off the floor. We have to clean each room after patients leave,
Right.
and to move that garbage can and all those other things that are on the floor is a lot. That's a hassle. So to have everything off the floor is a real benefit.
And that just ties back to your infection control efforts and everything else that you have to do in these surgical areas to make sure you have the area clean, including patient safety issues.
Absolutely. And safety for our staff. They're
Oh,
not
yeah.
putting on things on the floor either. So that's another piece of it that has been, great with this rail system.
That's an interesting point. I never thought about that. It is not only a patient safety, but it's a staff safety issue also.
Exactly.
That's neat.
And for efficiency for the staff, it's been nice because we've designed the rail system to have everything we need for an admission as well as to care for a patient post-operatively. We've incorporated a couple baskets to keep supplies in. So we're able to keep the room looking neat and tidy, but yet have all the items we need right at our fingertips without having to run to the, med room for everything. We have what we need right there at the patient bedside, and it looks nice.
Yeah.
And it's, aesthetically it looks nice and neat.
What it sounds like is it's not just a product. You've invested in the environment.
Right.
That's
right.
which is really important because it's something that will continue to work with you in the future.
Right.
So,
and it's something that we've been working with for about a month now.
Right.
We've discovered things that we might want to add in the future, which the Paladin accessory catalog is, there's many different things you can add. We've been able to kind of adjust things as we've gone along. So it's been very, very nice for not only the staff, in an efficiency standpoint with our patients.
So even after a month, you've been already adjusting things.
Yeah, someone might want the sharps container moved over
Right.
a little bit, or we kind of set up the head of the bed to, accommodate what we thought we needed. And after you actually care for patients in the space for a while, you decide, we really need to move this over here, or or this works better over here, and you can adjust it.
Which is fantastic, because it sounds like from the feedback you're getting from the staff that the flexibility it's bringing into in the environment is great for them. It's making them more efficient in their work.
Right. It has become a system that has allowed us to be more efficient in caring for our patients.
Thank you so much for doing this.
You're welcome.